Hello, viewers. Good evening. We are back again, and today I decided that I will be discussing on another important part of female infertility, which is called premature ovarian insufficiency. Now, what is premature ovarian insufficiency? So, I'm going to talk about both the aspects: women who have reduced ovarian reserve, and women for some reasons they stop their ovarian function way earlier in life. So, premature ovarian insufficiency means that ovaries which have stopped functioning way before the normal age of menopause. So, normally before 40 years of age, if ovaries completely, stop functioning, we call it premature ovarian insufficiency. Now, how will a girl present if the ovaries are not functioning? The girl will be presenting as normally not able to achieve periods at all. So, the normal age when we wait is about 16 years for a girl, where she is showing her secondary sexual characters, or in those cases where there are no secondary sexual characters at all. So, we'll start investigating by the time a girl is 14 years and has not achieved her periods. Okay, it's very important. And now, the second aspect is that what exactly happens in cases of premature ovarian insufficiency. Now, genetic is a very important cause in when we say that yes, a woman has not started her periods. Well, there are also conditions where women, girls are born without uterus and still they will not have periods. But we're not talking about that aspect today. We are talking about people, girls who have the uterus, who have the tubes, who have the ovaries. However, the ovaries are not functioning the way they should have functioned in life. So, genetic is a very important cause, and in the genetic, what we would advise the girl to go through, or a woman who comes to us, suppose in the reproductive age group and wants fertility, and then we come to know that she either never attained her periods at all, or if she attained, then very prematurely they stopped functioning. So, what we would be advising for them is a karyotype, which is a genetic analysis. And we can go further and advise them another genetic test, which is called the Fragile X syndrome. And this can run in families. And the mother can be a carrier, though her mother never had any issues in producing children. But this can go on to the daughters, and the daughters can be affected. And this can lead to premature ovarian failure. Now, what happens in genetic testing is that sometimes, yes, we come across conditions like Turner syndrome, which you hear, where one X chromosome is missing in these girls, and again they can land up with premature ovarian insufficiency. So, genetic testing is very important, and then many a times, even we would be asking for a genetic counseling, and genetic counseling becomes again an important aspect. Now, if suppose we know that there is a family where there is this fragile X syndrome disorder, so we know that this girl will land up in premature exhaustion of her ovaries. Or we have had a history where the elder sister had a condition where her ovaries stopped functioning, or mother had very early menopause, even though she had her children. So, in these cases, in these families, after the genetic tree mapping, it is very important that we do a genetic testing, and we can actually pick up this population, this subset of girls, where we can predict that yes, these are the girls where ovarian function can decline early in life, and they are the ones who can be benefited from fertility preservation. Now, I would very soon explain you that what is fertility preservation. Or there are situations in life like girls who are born with thalassemia major, or there could be any other metabolic disorders. And there are certain metabolic disorders again which affects the ovarian function and can lead to premature ovarian failure or insufficiency. Now, if we know that there are certain medical conditions in a girl, or these girls, young girls who are going through cancer therapy, so before that, what we can do, because we know that cancer therapy affects ovarian function, we can number one ask them that when they are at a stage where the ovaries are still functioning and there is a chance that they can lose their function very early, we can ask them to have their eggs cryopreserved, eggs frozen. So now these girls are more often coming to us for fertility preservation, because we know that they are in their early teens, they are in mid teens, they are in early 20s, they don't have a partner right now, but they can use their own eggs later in life if they have had them frozen, because possibly by the time they are mid 20s they would be failing their ovary. So this is a very important thing which I feel that people should be aware of, and they should come to us discussing about fertility preservation if there is a chance that the ovaries will stop functioning earlier, and we can very well do egg preservation. Now, what happens to girls who have already exhausted their ovaries and their hormonal levels are very, very altered? So, like we get a hormonal level done, which is called FSH, follicle stimulating hormone, which is very high, or AMH, anti-Mullerian hormone, which is very low. And from that, we come to know that, okay, no periods with very altered hormones. Then we know that these are the women who have established ovarian insufficiency, and now no medication can help them in getting their ovarian reserve back. However, what we can do, so they are not getting their period, so their uterus is also dysfunctional. We can give them hormonal treatment every month. We can give them sequential treatment like estrogen and progesterone, and we can help them in getting their periods back. Now, getting periods back does not mean that we will be able to get their ovarian function back. No, in cases of established ovarian insufficiency, we will not be able to do that on most of the cases, who have already gone and established ovarian insufficiency and failure. But keeping the uterus functional helps them in keeping the uterine lining better, so that whenever the fertility is indented, this can be of benefit. And number two, we also help you prevent your bone loss. So by giving a sequential estrogen, we are looking at the bone health, we are looking at the overall health of your body, because female hormones are important to maintain certain functions in the woman. Then what is the fertility solution? Well, fertility solution in such cases will be IVF with the help of donor eggs. Now, what are donor eggs? Donor eggs would be from anonymous, unknown donors. They are younger girls who have already had their one child, and they are in a particular age group who would be coming from ART, banks recruited from them, and we can offer you donor eggs, though the sperms of course will be from your partner itself. And then we can very well make embryos. And many a times this question is asked to me, that will my body accept these eggs? Yes, in human species we can. So then the next question asks us that how do we get these egg donors? We get them from bank, they are anonymous, we cannot share their pictures, but we can share their all the demographic profile, their physical characteristics, their educational background. We can find out that if there were any genetic abnormalities in the family or in the children. However, finding unknown genetic abnormalities is very difficult from a population. So the routine blood test, all the donors go through all the routine blood tests, all the infectious screen, ovarian reserve marker. Over and above that, they go through thalassemia screen as a routine, and we don't take donors who are thalassemia carriers or they are thalassemia affected. Of course, if they are thalassemia major, it would be known from beforehand. Now, if you are a carrier of a particular genetic disease, this also comes to us quite often, then we can offer the same genetic testing in the donor also, so that you will be assured that yes, donor is not a carrier of that genetic disease for which you are a carrier, and maybe you are taking donor eggs because of that. So this is legal in India, and yes, that can be offered, and with very high pregnancy rate to the tune of about 60%, which can be achieved when you are going ahead with such kind of IVF. So do not get disheartened, because half the genetic material is definitely from your partner, even though if you can't make your own oocytes. Uh, then we are coming to women in whom the ovaries have not exhausted yet. They have come, they are married, they want to go through IVF, but we identify that before a particular age, their ovaries have reduced ovarian function. Now, it's very important to identify this subset of patient. Now, what we can do then? There are certain priming agents, molecules, oral medicines, or it could be transdermal, you know, estrogens, it could be transdermal small quantity of testosterone, which can be given for about 2 months before starting your IVF process. And what they help, see, we need to understand that all the female hormones are produced from the male hormones, and every woman carries a small quantity of male hormone in her body. And if we can increase a little quantity of male hormone, then possibly we can increase the ovarian response. So whatever ovarian reserve you have, to some extent, it's not that it would be 100% working on you, but yes, in a small subset of patient which we identify, we will be able to make better quality eggs. Then we have different regimes, like we also offer double stimulation to patients in one particular cycle. Because we know that no matter what we do, no matter what injections we give, and then there's no point giving higher and very higher doses of injections, because after a certain dose, these injections are just extra in the body and they will not be working. So you need to be very sure that you are giving a particular amount of dose, and that is the upper ceiling for any woman, and we don't need more than that. More does not mean that you would be producing more eggs. We give a standard dose of drug, and with that, we know that if a woman has a reserve, she will show a response. The drugs have to be properly stored and they have to be standard drugs. So then what we can do is that if in one given cycle you're not able to produce that many of eggs, we can actually do 2 cycles back to back. And it has been known now, very well known, that a woman can have 2 or 3 cycles of egg growth, follicular growth in a particular cycle, and we can make use of it. We can club your embryos, and then we will be in a better situation to offer you better embryos. Now, in case you even require a genetic screening on these embryos, because maybe the female partner's age is advanced more than 35, then it is better to club embryos so that and genetic testing for any genetic abnormality can be performed. So this is what we normally offer to the women, by treating you, by selecting the cases, by offering maybe fertility preservations even before you have a suitable partner, by offering you, if you are younger in age, shorter duration of infertility, maybe certain priming agents, and maybe stimulating your ovaries with the help of medications, with the help of injectables, we will be able to achieve pregnancy even without IVF. And when you land up in IVF, for the reasons, whatever are required to undergo an IVF cycle, if you have that appropriate medical reasons, and during IVF we can help you in achieving genetically your own child, and using your own eggs. And then of course, last resort, if your ovaries are totally failed, have failed, then it is IVF with donor eggs. So I hope that I have briefed you about ovarian insufficiency, and how we diagnose and how we go about, and how genetic testing is so important, and a genetic counseling is also equally important in such patients. Thank you very much. Now I can take up some questions. Mr. Rohit is asking that what is the main reason of poor ovarian insufficiency? Well, it is genetic, it could be environmental, unknown, it could be autoimmune. Now, we know that antibodies against adrenal glands or antibodies against thyroid glands, previous ovarian surgeries, and cancer therapy are the main causes of ovarian insufficiency. Hina is asking that what vitamin will improve egg quality. Hina, there is no specific vitamin which will improve the egg quality. Your general diet has to be good with high quality protein, and you can do a regular exercise. However, if there are genetic reasons for ovarian insufficiency, generally it will not help you. Priya is asking me what are the other problems of poor ovarian insufficiency. So, see, the most important function of ovary is, of course, fertility because it provides the gamete which is required for procreation. But other than that, ovaries produce a very important hormone called as estrogen, and estrogen protects women from bone loss before menopause, and that is why you see more fractures in women after menopause, and it also helps your heart. So women are less prone for cardiac events before menopause, and it's only after menopause where the incidence of cardiac events like myocardial infarction increases, which you call heart attack, increases in women after menopause. So these are the two most important. And your also estrogen maintains your normal day-to-day function. Women who are menopausal can feel very irritable, can have hot flushes, can break up in sweats. So these vasomotor symptoms, which we call, are more common in women who are estrogen deficient, which is the main hormone from ovary. Thank you very much.